Did you know that there are some skincare ingredients that you cannot use while you are pregnant? In today's video, we'll be sharing you a few skincare ingredients that you should avoid if you or someone that you know is pregnant. However, before we continue further, I will appreciate if you guys help subscribe to the channel because it will help the YouTube algorithm. By supporting the channel, you will make sure our videos are ad-free and sponsor-free. Great day, ladies and gentlemen, I'm Dr. Inky, your digital skin doctor, and welcome to Skynfyx, the platform whereby we share with you everything skincare and skin related and help you make the right decision for your skin. Now in today's video, we'll be talking about 3 skincare ingredients that you should totally avoid when or if you are pregnant. Now this advice also extends to someone planning to conceive. First up, majority of the skincare ingredients that you are using are generally quite safe for pregnancy or someone trying to conceive. And this is because all the skincare ingredients that we have today are thoroughly tested for their safety, especially in pregnancy. But there are some skincare ingredients that you should totally avoid if you're pregnant or planning to conceive. First ingredient that you definitely have to avoid is retinoids. Retinoids are a class of vitamin A derivatives. That means that they are derived from a particular vitamin which is known as vitamin A. Vitamin A derivatives range from something like retinol palmitate and retinol, which you can find in a lot of skincare, especially your night creams, and a lot of prescriptive medicine as well, like adapalene and tretinoin. The reason why you should avoid retinol or even tretinoin in your skincare or in your skincare routine is because vitamin A does cause fetal malformations. The latest study from Netherlands, which ran from 1999 to 2007, whereby they covered pregnant women while they were on isotretinoin. And isotretinoin is an oral version of vitamin A generally used to treat severe acne. And what they have discovered is roughly about 36% of the fetuses were born with malformations. Malformations were not only physical, but it also affected their lungs, heart, and the brains as well. And because of that, there is a blanket ban on all vitamin A products. Now, no research have been done on retinol, which is the skincare equivalent of vitamin A, on pregnant women. But the reason why no research have been done is because it's unethical to actually test vitamin A on pregnant women, knowing that isotretinoin, the oral version, has already caused malformations in the fetuses. And because of that, you should avoid any sort of vitamin A topical creams or even oral when you are pregnant. Are you guys using any form of retinol? Please let me know in the comments below what retinol products that you are actually using. The second ingredient to avoid, hydroquinone. Now, hydroquinone is generally used as a skin lightener or skin depigmentation, generally prescribed by doctors. However, one of the issues with hydroquinone is they have noted that when someone uses hydroquinone, they actually show a high level of absorption of hydroquinone in their bloodstream. Roughly about 30 to 35% of hydroquinone applied on the skin can and definitely will be absorbed by your bloodstream. Now, even though there are no scientific studies that shows adverse effect of hydroquinone on fetal malformations or deformities, but due to the high levels of hydroquinone in the bloodstream, we cannot safely say that it does not cause fetal abnormalities. Hence, it's much safer to just ban and block the use of hydroquinone when you're pregnant or planning to conceive. Now, there are many alternatives to skin depigmentation that you can use if you stop your hydroquinone. Now, one of the main things that you can definitely use safely during pregnancy is either use vitamin C or even low-dose glycolic acid up to 10% on your skin to reduce hyperpigmentation, to clear your skin, and as well as to treat melasma. Now, because there's so many options that you can use to clear up your skin, definitely you can safely stop your hydroquinone when you're pregnant or planning to conceive. Number 3, salicylic acid. Now, we're not asking you to stop salicylic acid completely when you're pregnant. However, high dose salicylic acid, anything more than 2%, does cause something called salicylism. Now, this is because the salicylic acid applied on the skin is absorbed into the bloodstream, and high levels of salicylic acid in pregnant women causes the following symptoms. It causes nausea, vomiting, giddiness, and as well as stomach discomfort. And even in severe cases, high levels of salicylic acid can even cause coma or death. Salicylic acid is also known to cross the placenta barrier. Now, the placenta barrier is something that actually filters out all the impurities and toxins, preventing it from getting into the fetus. However, the salicylic acid molecule is small enough to actually cross the placenta barrier, and it can actually cause harm to the fetus. Now, even though there are no known cases of fetal malformations caused by salicylic acid, but because of the general condition of the toxic syndrome caused by salicylic acid, there is an increased risk of miscarriage or even intrauterine fetal death. So if you're planning to use salicylic acid, you can use any form of salicylic acid if it's below 2%, generally 0.5 to 1%. Or alternatively, if you want to avoid salicylic acid altogether, there are a lot of other ingredients that you can choose to help your skin. For example, if you're planning to reduce your acne, one of the safer alternatives is azelaic acid. And if you're looking for a spot cream, you can always use low doses of benzoyl peroxide, roughly in the range of 4 to 5%. And if you're looking for a gentle exfoliator for the skin, switch over to lactic acid or glycolic acid. However, if you still want to use salicylic acid, please note that you have to use lesser than 2%. However, that's not all. There is a bonus ingredient that you might want to avoid. Now, the ingredient in question is paraben. Now, it's been noted that high amounts of paraben in the bloodstream does cause an increased levels of cancer. So even though a lot of skincare do contain parabens, however, they actually contain a very small minimal amount. Now, this particular amount has been tested on a yearly basis and to make sure that it does not cause any issues on the body. Generally, what I would advise most of my patients and users is, if it's possible, when you're pregnant, do avoid paraben use when you are pregnant. This is because even though the small minute amounts does not cause harm to an adult body, but because the fetus is small and is still in the growing stages, we do not have a definitive answer that paraben does not cause any harm to the fetus. So if it's possible, try to avoid parabens. Alright guys, that's the end of our video. 3 ingredients that you have to avoid when you're pregnant or planning to conceive. If you guys like the video, please subscribe to our channel, click the like button and comment below. And do not forget to turn on the bell button because we release new videos on a weekly basis. And until then, I'm Dr. Inky, your digital skin doctor. And remember to stay safe, stay healthy, and most importantly, stay informed. Are you tired of wasting time and money on your skin, but nothing works? We are here to help. Skynfyx is a platform that provides personal care education completely free. Skynfyx is run by skin doctors and skincare experts. You can chat and consult with our skin doctors without ever leaving your home. Other than free advice, Skynfyx also provides tailor-made solutions for your skin problem with customized medical-grade skincare delivered right to your doorstep. Skynfyx, your digital skin doctor.